By day, I work in a clinical laboratory for a dermatology clinic. And then by night, I compose choral music. I love to sing, but I also love being outside and going for a run, hiking, climbing mountains. Back in 2006, I was a different person. I was about 100 pounds overweight, didn't care about my health too much, and went on a skiing trip, and I blew out my knee horribly. Fast forward about 5 or 6 years, I changed my ways and got healthy and lost 100 pounds. And then a few years later, I discovered that I loved to run. And after a couple of months of doing that, I was hooked. I was just addicted. I had to do it. Now I'm just in love with running. One day, a year and a half ago, I was out for just a normal run, and my knee started to feel kind of swollen and tight, and felt like it was gonna pop. My ACL tore again. And then about 6 months post-op from that, every time I went running, my knee was still swollen and painful. So back to Dr. Crawford, what's going on with my knee? And he said, well, you've developed osteoarthritis now in your medial knee joint. And he said, well, there's this new thing that you might be perfect for. And he described the MISHA knee system to me. I said, well, what if I do nothing? What if I don't have the surgery and just keep going on? And he told me, well, you'll never run again. That made it easy for me. I had a nerve block, a catheter inserted into my leg with nerve block drugs, and that lasts for 3 days. But after 3 days, took the catheter out, and as soon as the numbness wore off and I got the feeling back in the leg, I was walking. I put the crutches away, didn't need them. I thought that was pretty remarkable that I could walk 3 days after surgery. Any pain I had from the surgery in my knee wasn't very intense, but it was the muscles trying to come back to normal. That was the painful part. And then I saw Dr. Crawford 2 weeks post-op for a checkup, and he did some measurements, and my range of motion was great. It was like 130 degrees, which is more than he expected. On week 3, I went out and started interval running. When I'm walking, I feel nothing. It feels great. And actually when I'm running, it feels great too. It's usually after the run that the swelling comes. And importantly, when I have been running, what I don't feel is the pain associated with the osteoarthritis. It was a very specific, pointed pain, and it's gone. I just had the surgery in June of this year, 2023, and this past Wednesday was 12 weeks post-op, so it's been 3 months. Getting the MISHA knee system implant has restored my hope for the future in terms of my health, physical health and mental health. Being able to run on a regular basis is a big part of my life. It's part of who I am, and having the MISHA knee system is giving me that back. I wouldn't be able to do it without it. For the near future, the expectation is that I won't even think about it. I won't even know it's there. I'll be able to run and climb and do whatever I want to do, and so I'm looking forward to that. Nothing to hold me back.